Okay, so let's get started. Welcome everybody to the Northwest ATTC webinar, Preparing Your Office for Telemental Health. This is the second of a 6-week series of Fundamentals of Telemental Health. My name is David Jefferson. I'm the Director of Training and Technical Assistance, and I'm the host this evening. And we're very excited to have Dr. Sarah Smucker-Barnwell back again for the instructor for this evening and for the series. We're very excited about your participation tonight. We're eager for your questions, and we're very interested in this material being applicable in these incredibly changing times that we're living in. Before we get started, I want everybody to know here at the ATTC that we believe that language matters, words have power. We strive to be culturally informed and inclusive and value your feedback. And you'll see us put up our ATTC email address several times, and feel free to use that and give us some information. Couple of quick housekeeping items. During the presentation, if you have questions, please insert those into the text box. I'll be gathering those and then reading them for Sarah to answer as we go. We've also changed up the evening some. Sarah's going to tell you about that, so we'll have different question and answer periods. At the end of today, we would very much like to hear from you feedback on our presentation. So we're going to send you a link to our survey, and we'd very much appreciate it if you would fill that out and submit that. Also, everybody who attends will get a certificate of attendance. You don't need to do anything. You're registered. We'll send you the certificate of attendance. However, if you're part of a group, we would ask that one person take the names, first name, last name, and email address from the people in your group, send that to us at the Northwest ATTC email address, and then we'll make sure that everybody that's in the group gets that certificate. Again, we're very excited to have Dr. Sarah Smucker-Barnwell here this evening. Since we're in this webinar format, she can't see us, but I'd like to kind of give her an imaginary handshake and welcome. And with that, I'll turn it over to her, and then I will see you later toward the end of the presentation. Sarah, it's all yours.
Thanks so much, David. And thanks so much to everyone for joining this evening. If this is your first time joining us, or if you've joined us for prior installations of this learning series, I really appreciate your taking the time to be with us tonight. So we're going to spend some time today talking about how best to prepare your office to conduct telemental health. And I should note this is the second in a 6-part series, and these are going to be on Tuesday evenings from 5 to 7 Pacific time. And here you can see the different themes and topics that we are talking about. And if you'd like to register for future ones, much as you did today, you can go to the NWATTC website and register, and I hope you do. Okay. So hi, I'm Sarah Smucker-Barnwell. I'm a clinical psychologist licensed in Washington, and telehealth is really my passion. For many years, I had a telehealth only practice as I oversaw the telemental health team at VA Puget Sound Hospital System. I've had this wonderful opportunities in my career to participate in regulation and policy creation. And one of the things I'm most proud of is the American Psychological Association Telepsychology Guidelines, on which I'm a co-author, as well as guidelines for the American Telemedicine Association and the American Pediatric Association. I was also, in a former life, a CSATE fellow. My clinical work has focused on addictions, CSATE being the Center for Excellence in Substance Abuse Treatment and Education. So I'm really excited to be here with you and talk about this intersectionality between, caring for SUD clients specifically in the context of telehealth. And I will tell you time and again, I really am something of an unapologetic telehealth evangelist. I really believe in the power of telehealth. Now more than ever, I think this modality has a role to play in protecting our health, the health of our clients, and the public's health. So tonight we're going to talk about 3 major themes: video platforms, which ones we want to use and what features we're looking for, what additional technologies can help augment our practices, and how to think about our physical space. And in these ways, helping to really prepare our office to be telemental health practitioners. Now, I'll mention that if you happen to come last time, we're going to structure it a little bit differently. So again, we are going to have some lecture. You're going to hear a lot of me talking, and I do apologize for that. We're going to try to break in between some of the major sections so that we can break it up a little bit and then capture questions as they may occur. If you're anything like me, you may think of a question and then 30 minutes later, it's gone. So perhaps by breaking a little more frequently, we'll be sure to get to those questions that are very important to you. I will say, for whatever reason we do not get to your question this evening, please do not hesitate to submit that question at nwattctelehealth@gmail.com. And this is a Gmail address. You'll reach me directly. I'll be monitoring it, trying to respond to folks' questions. And, as they are submitted, if I think they're generalizable to others, include them in the following class's lecture. We're going to have some video demonstrations where you will all become very well acquainted with my family members who are very good eggs about this. And again, at the end, we'll have one final live Q&A. I always like to make the disclaimer that when I'm doing a technology presentation, something crazy will happen with the technology. That's the way it goes. I'm here to offer my best practice recommendations based on my clinical work, my review of the extant literature, and my understanding of the regulations. I'll always say this is not, this is no proxy for if you have a risk manager in your life or your malpractice carrier, and of course, the regulations of your jurisdiction. I'm really here to identify some personal best practice and give some guidance in this burgeoning area. But always review your state regulations. If you have a healthcare attorney who you speak to, it's good to talk to them about what telemental health requirements exist in your area. And, I always like to joke, I'm not an attorney, so I'm not here to give legal advice nor to set clinical care standards. Okay. Conflicts, we're always supposed to make our disclosures. Again, as I say, I really like telehealth, so I do tend to come down on the side of telehealth. And in other parts of my life, I provide telehealth training, so one could say I do have a horse in the race. But I really believe in this modality, and I believe in its opportunity to bring access to care to a greater diversity of clients. And to me, that's what telehealth, where it really started and where it continues to be at. The ability to bring the excellent care that you give to your clients to a diversity of folks, even under adverse situations like the ones we are living through right now, I think just improves the state of the world. So I really am a believer in this milieu. Okay, so some of the themes we're going to speak about today. We're going to talk a little bit about software selection, both video conferencing and other technologies to augment your practice and help prepare your office. We're going to think a little bit about preparing your physical space, how you're going to get either that home office or that professional office ready to deliver care, and how you might prepare your staff, how you're going to help them to make this transition, especially if you're having your staff use telehealth in any way that's intersectional with your clients. And of course, we're thinking about these themes in the current context. We kind of can't think about these things without thinking about novel coronavirus and COVID-19 and its implications for how we're using telehealth, when we're using telehealth, and the role that telehealth plays in our office moving forward. And I will say, I'm trying to strike a balance, and I'll, feel free to opine on how it feels for you. My goal is to give some brief review to topics that may have been touched upon in previous sessions. And in each of the learning series, we're going to be doing a deep dive on specific themes. So today, preparing our offices, technology selection, physical space, and staff training. And in other sections, we'll be diving in elsewhere. So I'll ask you to bear with me that there will be some operational definitions that we'll review briefly, that may sound a little familiar. So please know those sections that have any repetition from prior learning series sessions, I'll do my best to minimize. And as always, I'm seeking to answer your questions. So we're going to try to break a little bit more today and get those questions answered. Okay, our abbreviated definitions and examples. All right. Jason, thank you so much for joining me today. You are not only my beloved husband, but my frequent collaborator in the creation of TMH videos.
Happy to be here.
Excellent. Well, as you know, the thing I am really excited about is the democratization of TMH, of how we are bringing this technology
to more folks and really, allowing them to roll it out in their practices in ethical and secure, safe ways. I think today we're going to be talking TMH to a group of providers with SUD backgrounds. And specifically, we're going to dig into some of the nitty gritty around VTEL, how to get a BAA, maybe integration into EMRs, and we're going to think a little bit about things like screen sharing, stuff like that, because some of them may have a practice that includes PE or CPT, something like that. You're a tech guy. I'm wondering if you have any additional things that, you think I should be sure to touch on.
Well, you and I have discussed a lot, about the importance of security and making sure that if you're connecting to resources that are sensitive, ideally you're doing it over a VPN, that your SSL certificates are all up to date, and that whenever you're connecting to anything over the internet, you're doing it through HTTPS, so that you're using that secure socket layer.
So important for PHI, yes. Something occurs to me. Some of this telemental health stuff can tend to be a little jargon heavy. I don't know if you've noticed.
I have noticed that, yes.
Yeah, it likes acronyms. It likes, words that I don't use thusly in any other walk of my life. Now, I feel very sure that you and I and all, viewers who might attend this webinar know every acronym and we know every piece of jargon. But, just for the sake of posterity, perhaps we should spend a little bit of time on operational definitions and decoding some of this dense jargon.
That makes a lot of sense.
Okay, let's do that.
Okay. We will try our best to make this to keep it light and to keep it interesting. This stuff has a lot of jargon. I really think that, telemental health is a discipline that likes to differentiate itself with jargony words and acronyms. And that, I'll tell you, when I was first getting started in it, I found it unnecessarily dense. So we're going to go over some of those fundamentals. And again, if you've heard this previously, I will try to move quickly through this section. TMH, or telemental health, this is the provision of any mental health service using telecommunication technologies. Telecommunication technologies is an incredibly vast and broad, set of technologies. So we're talking about telephones, we're talking about video conferencing, the fax machine, we're talking about emails, we're talking about text, to the point where I think it's so broad, almost to the point of meaninglessness. But really, when most folks talk about telemental health these days, I believe they are most often speaking about video conferencing and telephone services, and really video conferencing more than anything else. So for our purposes today, when we talk about telemental health, we will be speaking about video conferencing and telephone appointments. And again, I just want to reiterate, for me, access is at the heart of this mission. Telemental health really got its start serving rural communities in which there were not other care resources. So I spent a great deal of my practice working with folks who lived in rural Alaska, or in just these really remote communities where the nearest medical provider was many hours away. And in doing this work, it really became clear to me this was a tool that could bring good care to folks who needed it. Now more than ever, that feels very salient. For many of us, we may live in areas with stay-home orders. I know here in Washington, we have one in effect through the end of May. Others of us may have health concerns or loved ones with health concerns that, make our leaving the home, more problematic. And so for these folks, I think right now, telemental health, now more than ever, it increases our access to care, and I think improves the state of our public health. HIPAA, that Health Information Portability and Accountability Act, that federal regulation that is speaking to the privacy and security of healthcare information. Generally speaking, PHI includes things like names, addresses, birth dates, and this we typically know. I think as we get more into telemental health, we think a little bit more about ePHI, that electronic PHI. And I know I was surprised to learn things like IP addresses, like medical record numbers that are in our EMRs, like serial or device numbers in some circumstances, actually can fall under the rubric of PHI. So we're going to talk about PHI, and how we can think about protecting it today. EMRs, or electronic medical records. This is just a digital version of that traditional paper-based medical record for an individual client. An example would be Simple Practice or Therapy Appointment, TheraNotes. There are many great ones out there. And we're going to be talking about EMRs today because I think For some of us, we made this initial leap in telehealth during these early weeks of adapting to the demands of COVID-19. And some of us did elect to bring telehealth into our practice, or some of us had to bring telehealth into our practice. And that to me wasn't really the moment. That was not the moment to change how we keep our records. It was not the moment to change how we do our billing. But some of us may be looking forward and saying, I think telemental health is going to be in my practice for some time. And as this becomes a reality for more of us, and as we transition out of those early days into being thoughtful about how this becomes a mainstay of our practice, if we have not already transitioned to using an electronic medical record, it may be something that we wish to consider. BAA, or Business Associates Agreement. This is a standard form that basically is a contract between you and a HIPAA-covered entity that says, you as a HIPAA-covered entity, and another business that says they too will act as a HIPAA-covered entity, so that they will acknowledge and abide by all the rules of HIPAA and be good partners to you as you use their technology to serve your clients. So I would just want to reiterate the conversation around the use of telehealth and why we're talking about, these definitional terms. It's just so different now than it was 6 months ago. I think in the current public health crisis, this becomes a tool for social distance. And really, as I've said in prior learning series sessions, 6 months ago, if someone told me, well, I don't really know if I want to do telemental health, or, I'm not sure if this is the right thing for the client. Well, of course, we wouldn't even think twice about it. Now many of us are in situations where it's being required by our workplace, or we live in an environment that it really just is a necessity. And I think in those instances, we're having to be more thoughtful and more inclusive in how we think about telemental health and its application. Okay, so let's talk a little bit about selecting technology products. And I'd like to get off on the foot of starting about video conferencing platforms. This is probably what I am most frequently asked about. And, I'm happy to tell folks what platforms I use, in my professional life. And I actually share, you're going to see several of the ones I use today, sort of what it might look like. Many of us use these in our personal lives, of course. We might FaceTime or have an echo, show or something like that. But, we're going to think about it in a healthcare context. Okay. So, we recently had a big change, and I think it's really important to note that the U.S. Office of Civil Rights and Department of Health and Human Services on a federal level made an announcement saying it is okay to use non-public facing video conferencing products. This is really big news. I will mention that this is a very contested announcement. So for example, the VA system initially said, oh my goodness, we can use these products. And then almost immediately, the Attorney General for the VA came out and said, no, you can't. So I don't quite know where it's lying these days, but it's been back and forth quite a bit. But basically, the federal government came out and said, we need to make telemedicine accessible. So now you can use Zoom, you can use Skype, you can use FaceTime to see your clients. Now, it's notable they're talking about non-public facing products. So, you can't go on Instagram TV, you can't go on Facebook Live, and see your clients there. You can't show everybody, your sessions. Privacy and security are still important, but they're suggesting that we use these products that are designed much more for business applications than for healthcare applications. But I really want to note that state regulations may still advise the use of healthcare products. And if you're looking for any changes in regulations in your state, I encourage everybody to go, and I'll have this later in the slides, to the ASPPB, the Association of State and Provincial Psychology Boards website. They've done a really nice job on having a COVID-19 section that goes over all the regulatory changes state by state. I guess my point here being that if we have a board complaint, it is likely to come from a state level and not a federal level. Someone's upset about something, they're likely to complain to the state board, that licenses me, and not the federal government. So I'm very interested in what my individual state has to say about what products I should be using and whether or not they think it's appropriate for me to use Zoom or FaceTime. That being said, if we had a board complaint, if we had a problem, there has been this federal announcement saying it's okay to use these other video conferencing platforms. Okay, but this is a really big marketplace. There are lots of products, some public facing, some not public facing, some designed for healthcare, some not designed for healthcare. And they have a great diversity of features and notably a significant range in costs. And I'd like to spend a little bit of time digging into, what are those features that we should think about when thinking about whether or not we want to, move forward with it. So first I want to think about, whether or not it is integrated into my electronic medical records. So there are standalone products that, like for example, Doxy.me is a product that is free. It is just a waiting room, that your client can go into, and then you can go on to have an appointment with them. It's quite different from something like, let's say, the video conferencing element that is embedded in Simple Practice, which is actually integrated into that EMR. We want to think about whether or not we have an EMR, if they offer a video conferencing option, and if it is, if it's any good. And we'll talk about what features we might be looking for. Most notably, I want you to ask whether or not the vendor offers a BAA, because if it's designed for healthcare, they're going to offer you that BAA, which is, pretty important. I think in what you'll find, and we'll dig into this a little bit more, but those products that are not designed for healthcare tend to be more feature rich, which is a nice thing. It's nice to have more features on your video conferencing product, but it's also a riskier thing. So for example, they may enable cloud recording. They may allow you to record your sessions, on a product designed for business. That's great, because maybe you want to remember what somebody said at a business meeting. However, if it is for a healthcare meeting, well, recording that session, creates privacy and security concerns. And I'd want to think about where that information goes. Is their cloud compliant with HIPAA? Am I sending a recording of my therapeutic session off into the ether somewhere? So it's these themes, those healthcare products, the ones that will give you the BAA, tend to be a little bit more feature impoverished, I would say, compared to those business products. But oftentimes the reason they are is because they are being more thoughtful about privacy, confidentiality, and security. So there's really a range of costs. And I think this is important to note. I'll be honest, the product I love to use, I like the Zoom HIPAA compliant product. It starts at $300 a month, and that's pretty darn pricey. Alternatively, I can use Doxy.me for free. Or I have integrated into my medical, electronic medical record, a product that costs me $10 a month. Or I could, use a product like VC or Vidwio, and later slides will have all of these names, not to worry. But I think we want to think about what your practice can reasonably afford, what makes sense and what's not going to break the bank, and what features you're going to get for that cost, as well as access. Is it a product anybody's ever heard of? Is it easy to use? And are there good reviews? Have people come before you? Have they used it? And what do they have to say about their experience with this product, inclusive of their experience with the customer service? If you're looking for a reliable place to find reviews, I always recommend that people check out Capterra, Kapterra, and I'll put that in the chat box in a little bit. But Capterra.com is a federal site that actually gives you reviews of healthcare technology products, and it's pretty darn handy. Okay, so some features I'm looking for. I want to know how easy this thing is to use and how good is their tech support. So some things I'm looking for when I'm looking at that video conferencing product. Do they have training videos? Oftentimes the vendor themselves will issue the training videos. So you could go on their website and they'll give me a nice how-to tutorial with screen sharing and go through what it looks like to use their product. Or alternatively, can I go on YouTube? If I wanted to use Zoom, I need only go on YouTube and there'll be 100 videos, instructing me. Is there a way to contact a human being? Is there a way to contact that human being in short order? I think a lot of times you have a great product, but there's no way to get customer support, or, you enter a form on the internet and maybe somebody gets back to you and maybe they don't. I want to work with a company that has staff dedicated to helping me in real time and not just a chat bot. And do they offer training appointments? Many video conferencing platforms will have specific customer service lines of service that will just meet with you one-on-one, will train you how to use it. This is particularly the case in those video conferencing platforms that are integrated into your EMR. Okay. Do you have a self view? How can you see yourself? Can you see what the client sees? And how big is it? Do you have the ability to make it smaller or larger? Do you have a waiting room? I think this is a very uninviting waiting room picture I've chosen. I guess it's for pigeon deterrent. do you have a waiting room where the client can wait and see you? So, for example, many Zoom appointments, you can enable the waiting room where you let people in or don't let them in. Products that are designed for healthcare very often will have some sort of waiting room feature. I rather like this because it gives you an opportunity to make sure that the right person is there at the right time and not have any confusions. Is there a password associated with unique links for your video conferencing appointment? And can you lock the room? Most products these days, this is not a concern. I'll share with you, a decade ago, sometimes you'd have an open room that if you didn't manually lock it, you could have two clients join you at the same time, which would be a problem for HIPAA. Didn't really intend to make the party line. So, these days, most are going to have the ability to add a password. Most are going to lock that room. And most are going to have features like screen sharing. I'm going to show you just what that looks like in a moment. Okay. Video conferencing platform features I look for include the ability to do multi-call, have multiple callers on a single video call. We take it for granted in a product like Skype or Zoom or Google Hangouts. Those are products designed for business. And I have to say, this is where those non-public facing business products shine, is when it comes to having more than one caller on that video conferencing call. For the products that are designed for healthcare, typically the free features may not enable multi-call. You may have to pay, for the multi-call feature. But I will say that one thing we're seeing in these free products is that they were never really made to withstand the traffic that they currently have. And this seems even more pronounced in circumstances where we have more than one client attending a session at the same time. So a family session, a couple session, a group session, this gets even more complicated. So, you want to think about how often do you do sessions that include more than one caller, and does the video conferencing platform you're looking at enable more than one caller, and how well do they do it? I like a product that automatically generates reminders and video links and sends them to my participants so I don't have to remember to do it manually. I like to have that integrated into my EMR. It goes out with appointment reminders is a nice way to do it. Or some video conferencing products will just have a secure email feature that will remind the meeting participants when their meeting is and what link to use. We want to make sure that we have passwords, that we are using unique links and unique identifiers so that, and these are typically checkboxes you can just select. And a well-designed healthcare product, this will be very seamless, and this won't be something you have to go digging through the features to enable. Okay, some less delightful features that you're going to find, and they're the ones that they're nice to have in a business milieu, but they're things I want you to kind of look out for, in a healthcare product. Instant messaging. Instant messaging is great, right? We have this chat box, and I can, put the word Capterra, like I said I would, in there. Hey, Capterra.com. And it lets us, communicate with one another, and that's excellent. However, it creates a problem in as much as we want to be thoughtful about our ability to keep that information secure. So if the video conferencing product is keeping a record of those secure message, those instant message chats we're having, that can be problematic for us. I seem to have lost the ability to advance my screen. Haha. Okay, it's back. Hooray. Recording. As I mentioned earlier, we don't want our sessions recorded without our consent and without the consent of our patient. There are some circumstances where that would be indicated. I'm thinking of certain elements of prolonged exposure or, other places where we're having clients rehearse scripts. We may want to record and have them watch a section of it, but it's the type of thing that we want to be really thoughtful about, and we want to make sure we have informed consent about. So, most video conferencing software will not allow will inform everyone on a call when recording commences. So it would not allow someone to be recorded absent their permission. Still, it's easy enough to miss that. If you joined today, likely you had some indication that this meeting was being recorded. And, if you're like me, you just are kind of clicking to get on, and so perhaps that's something to fly by rather easily. So I want to look at whether or not that product that I'm considering using has recording, and if so, how it is enabled and how people are notified when recording commences. Backgrounds, it's really fun to have like a tropical island in the background. It looks really nice. I think the challenge is that these backgrounds, while they're really cool looking, A, I think they distract from the clinical relationship and from that good care that you're delivering, but B, they also create additional bandwidth demand on your call. And in doing so, I think can diminish the quality of the video conferencing call you're having with your client. Okay, call security. And this is where we start to get into, this is more human behavior than the video conferencing products. But, we want to think about, we're getting ready and we're thinking about what video conferencing platform we're using. We got to think about our own behavior. We want to make sure that we are not sharing video conferencing accounts. Now, sometimes we may buy an enterprise level account and have, multiple sub accounts, from that major subscription, but we want to make sure we're not just buying one, Zoom account and then sharing the password with our buddies who are therapists also, because it creates too many risks for information security. Want to make sure we are not auto-saving that password. It's so tempting, and I really hate putting the password in every time. But we want to use some good common sense that if someone stole our computer and somehow managed to get in, to our profile, they couldn't just automatically log into our video conferencing equipment, because we're really thinking of this as EPHI now. Double checking where those links are sent. Gosh, I had this happen this very week. I might enter an email into my electronic medical record or just into my client's record somewhere. And that email, maybe there's a typo in it. It wouldn't be a big deal under normal circumstances. But if that email becomes the email that my client's video conferencing links are sent to, it does become a big deal. So perhaps it's accidentally sent to someone who is intended to be, a support person or a contact person. Oftentimes people will put a shared email as their email contact in their record, which is a totally legitimate, fine thing to do, unless we're starting to deal with healthcare. In healthcare, we really want to try to, as much as we can, send information just to the client and no one else. So in that way, we're thinking about where are we sending these video conferencing links, and of course, don't consent to recordings that we don't intend to have. Okay. So let's talk a little bit about what it looks like in that video conferencing environment.
Okay, so here we are in the video conferencing environment. And, we're going to spend a little bit of time reviewing some of the features and showing you what they would look like. Now, first and foremost, we're sitting here in self-view, so I can see myself as my client would see me. And this is actually very helpful information. Now, normally I wouldn't be sitting in the video conferencing environment by myself. That's a little odd. However, I will mention for about a decade, it's how I did my makeup before starting my day as a video conferencing therapist. But, typically we use this tool to see what the client will see. So before inviting a client into my treatment room, I check my self view. I want to make sure I'm centered in the screen. I want to make sure my camera is angled in such a way as to see all of me. And I just want to make sure that things are looking pretty good. Looks like the call quality, at least as we're recording it here now, who knows how it'll be later, is looking pretty darn good. I'm in the middle of my screen. Everything looks pretty darn austere. Good to go. Now, we're going to make some assumptions that some things have occurred already. Doesn't make for great television, but let's lay some foundations. We're going to assume that we're using a product that is designed for healthcare. And indeed, today we are using Zoom's HIPAA compliant product. Now, there are lots of great HIPAA compliant products for healthcare. I'm just picking on this one today. But, again, these are the products that will offer us that business associates agreement, indicating that they will be good partners in HIPAA compliance. Now, as we know, Zoom is an entity unto itself. It's a company that's a standalone company, and it's not necessarily integrated into an electronic medical record. So, for example, I have an electronic medical record, Simple Practice. It has a video conferencing component. I may use that sometimes. I actually keep this Zoom account as a redundancy, and I like to use it for other things too. And so, again, I always recommend that we have a couple platforms that we're working with and that we're feeling pretty competent in. So this is a standalone product, could use it in and of itself or could use it to augment another product. I do want to mention that this product's a little on the pricier side, and that's largely because it has a lot of features and it's pretty darn easy to use. It is a product because it's not integrated into your electronic medical record notifications. It is something that you're going to have to either configure reminders for your clients or manually send that link so they can join their video conferencing call at the correct time. But let's talk a little bit about these features that it has. First and foremost, I'd like to talk about screen sharing. Screen sharing is a tool we may use to share information from our computer screen and show it to our client. I use this for diverse purposes, sometimes showing clients normative drinking data to discuss that, or perhaps a chart that I'd like them to reflect on. Exposure videos, this is a great tool to watch them together. In this current coronavirus context of not always being able to hand people documents, it can be a nice way to facilitate showing information on documents. So a self-report measure that I'd like them to report on, or even information for homework that I'd like to exchange back and forth. Again, acknowledging there are some specific issues that happen when you do remote assessment like that. We're going to cover it later in the series. Okay, so let's not talk about it, let's be about it, and let's do some screen sharing. So I'm going to share with you my screen and show you some things that I see. Okay, so here we're just in our plain old Zoom window. But as I mentioned earlier, this is a product that is designed for healthcare. So I thought I would show you what their HIPAA Business Associates Agreement looks like. A BAA is a document that will always standardly have certain components, inclusive of their indication that they're going to comply with HIPAA. I like to note that typically there will also be some specific to the product components, and in this case, it's indicating, what features are enabled, what features are disabled. Here it talks about the manner in which they have disabled cloud recording, which makes sense from a HIPAA component. Always want to know where that data is going. And additionally, they have encrypted a chat feature. They've disabled screen captures. They've disabled sending images. These are, again, just intuitive, smart things to do if you're going to be complying with HIPAA. So, as you're looking at video conferencing products, I'd always take a look at that BAA, see what it has to say. It's just good information. You want to make sure you read things you sign. Okay, we also want to choose a product that has been reviewed by others. Let's not reinvent the wheel. Let's let others give us good insights into, what is good about the product and what is challenging about the product. So in this case,
Sarah,
I have
question.
looked up our Zoom meeting review here.
Hi, Dave.
Okay, so here we are.
Hi, David.
Oh, just quickly, I wanted to let you know that things are a little blurry, so if you wouldn't mind reading some of the stuff on the slides when they come up. That's all.
Okay, well, why don't we move forward, because
Okay.
much of the section does, have to do with screen sharing. And then, it goes on to talk about configuration of view. So particularly when we are, thinking about how we want to configure our video conferencing. And in fact, what I may try to do is go back and advance the video so that we skip over the screen sharing. Basically, I was just showing you some of the products, BAA, looking at some tutorial videos that may have, but mostly just trying to show folks that's what, it would look like to share a screen. Although apparently when you're sharing a screen within a screen, bad things. But perhaps we could advance in the video and look instead at configuration of self-view. Does that seem reasonable, David?
Yeah, that seems great. I'll watch and give you a little notice.
Sounds good. And if not, we can just skip it and move right on.
Okay.
Oops.
Click.
Are you able to start it?
Okay,
Looks great.
we're back to our self view. And that's great, but there's no one else on the call. Now, Zoom is a product that handles, adding one person, adding many people. It's actually a product I think that sort of shines when we're adding more than, one person to our call. And again, that's something we'll dig into later in the series. But let's see how it looks different when we add another participant. Okay, and now we've added another participant to our call. Hi, new participant.
Hey, I have a little friend with me today. This is Nymphadora. She might be a little whiny today.
Well, aren't we all sometimes? Okay,
Yeah.
so now we've had someone join our call, and here, we can see both myself and the other participant. And, you have some capability within your own call to configure how large or small you'd like your image and how you would like it arrayed. Notable in the Zoom product, they have speaker view and gallery view. In gallery view, I can see all participants at the same time, regardless of who's speaking. Alternatively, if I wanted speaker view, then we're just going to see the person who's speaking. It's all fine and good, except for, in therapy, I think it can be a little jarring to have it going back and forth like that. So generally speaking, for therapy, I recommend doing gallery view, minimizing, your image in the screen, and just, getting as much screen on your client for that data as you can. So, here we are. And in this way, I can see myself, I can see my client. I'm actually keeping myself large digs, and I make myself a tiny tile. It gets a little confusing. Now, I've had lots of folks say to me, well, wait a second, why do I want to look at myself? I know what I look like, and is it really that wonderful to stare at my own image? And the thing I'll note is that it's really easy to accidentally wander out of frame, or to let our posture get pretty bad. It's easy to just not comport ourselves in the way we would like to be seen by our client. So again, having that self view is a nice check on what the client is seeing. And again, we can configure it in different ways, but I definitely recommend keeping it on and not disabling that feature. Okay, thanks, Nifedora. Thanks, new client. Thanks for coming.
Bye.
Bye.
Okay. So sorry about that, and sorry for the disruption. Let's talk a little bit, and I should introduce to you all the new puppy, the Apocalypse puppy that came to our household. Now you have met. Okay, so let's talk about those technologies in addition to video conferencing that can support our office as we transition to telemental health. I think one of the most critical pieces is document transfer. Thinking about how we're going to exchange that informed consent document, that emergency plan document, any homework we might have with our clients, thinking through themes like signatures. How am I going to get a signature for my client on those documents? And how am I going to get those new intake documents, those assessment documents, particularly if I have an assessment-focused practice? And I should mention assessment-focused practices is something we're going to dive into later in the learning series. It's a special set of, bless them, it is a special set of challenges those folks are having right now. Okay, so we can think of some higher tech solutions. We can think of a secure file transfer program. And again, this is something that you'll often see integrated with an electronic medical record. So if you have an electronic medical record, very often they will have some client portal feature or some sort of communication feature that allows you to send a message to your client in a way that is encrypted. I should note that there are companies that have made their business of, providing encrypted email, or encrypted messaging designed for healthcare, and that's an option for us as well. Email, of course, is another way we can be transferring documents. Again, you can pay for a secure encrypted product. I happen to use a product that's pretty basic and things that folks use quite a bit is Office 365. I'll mention it has what we would call back-end encryption, where I happen to know, the information is secure and they're using a certain type of standard bit key encryption, so they're doing a good job. It also has the option of doing something called front-end encryption, wherein, when that email arrives in my client's inbox, they actually have to log in using a password and an ID to get access to what the information says, so that someone, let's say they hand someone their phone or someone's looking over the shoulder, at an email coming in, this can't be just accidentally seen by someone else. It has to be logged into and read with intent, not unlike a My Chart or something like that. I will also share with you that my clients absolutely hate front-end encryption, and I go through phases where I keep it on and I take it off. These days, honestly, I mostly just use the secure messaging portal that's integrated into my electronic medical record. Okay. But there are lots of ways we can do this that aren't so high tech, that are just as good. If you have a fax or a digital fax, this is a great way to transfer documents back and forth, particularly if you have a product like Faxage or one of these HIPAA compliant digital faxes where we really can just scan something, upload it, send it through quote unquote fax, and it is something that the client can retrieve using a mobile device or a computer. Most faxes these days use technology very akin to email, so I even find the distinction between fax and email kind of goofy, but it's another way to go about it. If you want to put your forms on a website where people can download them, it has no concerns about PHI because at that point they're not filled out, but it's a very simple way to get clients their forms if you happen to have a practice website, perhaps through Psychology Today or something like that. Screen capture on video, like we just looked at, if we do some screen sharing, they can simply do a screen capture, by hitting on their computer and just saving it. Again, this isn't the most elegant solution, but it gets the job done, and of course there's the mail. It takes a long time, but that's okay. We have the post. So not uncommonly when folks say, how in the world am I going to do this? This is all, more than I care to think about at this moment in time. I say, just stick it in the mail. If it doesn't get there perfectly on time, we do our best. We verbally review the information with the client. We document in the chart that we did so, we move forward. But coming up with a solution for document transfer, particularly if we think we're going to have telehealth in our practice, for a longer term, I think is a good investment of our time and of our money. Identity verification, emerges as an area in which we just see a little bit of extra challenge in the telehealth modality. So, your practice will determine how necessary this is. I'll share with you, I have a practice that's primarily a therapy practice. In these days, it is infrequent that I am seeing clients that are court mandated. It is less frequent that I am, communicating with POs. I've had times in my practice where that's been a really big part of my practice. There's right now I'm not doing UAs, I'm not doing breathalyzers, these things for my practice, it's a little less salient. But previously in my clinical life, it's been pretty darn salient, and identity's become a big issue, particularly if someone's coming in to do a UA, we really want to make sure they are who they say they are. So over telehealth, obviously we're not doing UAs directly, but we want to think about how we can capture and verify a client's identity. This can be done through third-party vendors. There are HIPAA-compliant identity verification companies that will do this for a fee. I will say, however, that, I always joke, like, I'm not a bouncer. So if someone shows me an ID, it's not like I'm going to know that it's a false ID, but I will know if their name says what they said it was. So for me, when I have someone come into my practice these days, I usually get an insurance card and I get their, state driver's license. And, now over telehealth, I ask them to do that. I ask them to show me, over the camera, or to upload a photo ID, a copy of their photo ID for my records. So it's, again, I would do this through either a screen capture or a secure document transfer, but in some way getting a copy of that ID. It's a very sort of low-tech way to go about identity verification. And again, they could mail me a copy of their ID, but just making sure that I've been thoughtful about this issue, particularly if I have a forensics practice or something where it's going to be really relevant that I double check that. Okay, invoicing and getting paid. Again, I think this is one of those areas that EMRs often shine. They will often have some sort of integrated online payment solution, but there are many third-party online payment solutions. I will say I really don't like the option of credit cards given verbally. I've known folks who have done it, and it's something we can do, and you can enter that manually. But I will say, as much as we cannot touch people's, financial information, I think our lives are happier places. So, again, if we can use something that's integrated into our EMR, that's incredibly advantageous, but HIPAA does not prohibit us from using products like Zelle or Chase Pay. I will say the one that I like less is Venmo, even though it's very popular, only because they have this public-facing component where it will say, Sarah Smucker paid so-and-so, for this service. So we want to be sure that folks are disabling that feature when they're paying us. And I really just got to say, I don't love Venmo. So I actually don't accept Venmo in my practice. I think it's too problematic. But PayPal, other ones are great, and we are allowed to use them. And again, we don't need a high-tech solution. Mailing an invoice and getting a check is a perfectly valid way to do this. Okay. So finally, we want to think about our ease of use, in all of these across electronic medical records, thinking about their billing, thinking about their invoicing, thinking about their insurance submissions. We want to make sure these are easy to use. They have tech support. There are training videos. Again, it's the exact same thing as video conferencing, some way to contact staff immediately and some ability to have one-on-one training. And I really like to make sure that they have some sort of mobile application. I think, an EMR that has a mobile application integrated into it is very convenient. Most of us have mobile devices. I think we're traveling a lot less than we used to, but in our day-to-day lives, having the ability to have a secure way to check on our practice when we're away from the office that is accessible, I think is incredibly convenient. So if you are electing to look into investment in an EMR, choose one that has a decent mobile application. I think it will pay off. Okay. These days, many EMRs have integrated assessment measures. And, I think they've done the good work of pursuing permissions to use those. So, as we know, a lot of these measures are copyrighted in a way that you have to purchase permission to use them. So a lot of the electronic medical records have made partnerships, either they have uploaded the free measures, the ones that everybody's allowed to use and they're smart to do so. But in some cases, they have unique business partnerships with some of the vendors that offer these measures. So if you're choosing an EMR, check to see what assessment measures they offer, because it's a very convenient way to send assessments to your clients in a way that's integrated, with other messaging you'll be doing with them. Oftentimes they'll have a unique way to do intakes or onboarding of clients. They may even have an advertising portal, but some way to have a client come fill out their history, perhaps sign online, to capture a digital signature for their informed consent document. I will note that some states do have a requirement for a physical signature on those intake documents, so it's a worthy thing to check out. I think it's the minority of states, but still worthwhile. Want to think a little bit about how the EMR will remind people, especially if you're using those video links. But a lot of them will have text reminders, emailed reminders. Some even have an IVR or an interactive voice feature where a robot will call your clients and tell them about your upcoming appointment. Do they have documentation templates for intakes or for assessments? I rather like, my EMR actually has a partnership with Wiley, who does those snazzy treatment plans. And I rather like that it's integrated in a way that's very easy for me to use, because it cuts down on my documentation time, and helps me just forge ahead with my telehealth clients. And again, I should note, these EMRs would be used for your in-person clients as well. I just think when we're thinking about communicating at a distance, these EMRs features become especially salient, particularly when we're thinking about communicating, gathering documents, gathering payments. So we want to think about billing and financial management software. Does it have an integrated payment solution? And does it do any type of reporting? So one thing I rather like is it will run me a monthly report as to anyone who has an outstanding balance, checks in on what insurance payments are due, or where things are standing, with waiting on insurance. And, does it integrate with other financial software that I might use? I know my accountant happens to use QuickBooks. So I like the fact that my financial records that come out of my practice software are very easy. I can download it and send it to the accountant, and the accountant's happy. And when the accountant's happy, I'm happy. Okay. I think a feature I'm just starting to see pop up in various EMRs are the ability to think about how we're talking to collateral reporters, to parents and caregivers. So parents in the case of children, perhaps spouses or emergency contacts, or third-party payers for our clients. Historically, I think they've been very cautious to give us any method, to communicate with these folks with good cause for security and privacy reasons, confidentiality. However, now I think more and more EMRs are having a limited feature set for people who are a payer or a parent. So maybe the parent can come in, they can request access, to the records. Depending on your state, they may have a legal right to those records, but they can't just go in and read, overviews of every kid's session, but they could perhaps go in and pay the bill. They could check the date of a session, I think, or, whatever features they're allowed to have. And again, your jurisdiction will dictate what parents are allowed to know and what they're not. So too with third-party payers, they may have a very limited set of features where they can go in and pay the bill, and that's about it. Okay, so again, with EMRs, we want to think about the cost, and we want to think about the term commitment. Are they offering, discounts for doing a year subscription versus month to month, and really making sure that we're ready to make that financial commitment to them. Have we seen positive reviews from our colleagues? Will they give us the BAA? Do they have integration with partner companies that we think are advantageous? Do they offer sound educational programming to us to make us really power users of their product? And, again, to EMR or not to EMR, I'd say that if telehealth is in your practice in a very temporary way, if this is something that you're just saying, hey, look, this is just for the time being, and then when hopefully things settle down, from the current COVID-19 situation, I'm really going to go back to 100% in-person practice, and I don't have an EMR, then my counsel would be like, wait and see, because it will, it will require some bandwidth, particularly if you bill insurance. This becomes, you're going to have to bill insurance in a new way, which I think adds complexity and requires, time and study. So, thinking about your willingness to make this transition, as well as your client's willingness to make this transition. I know when I transitioned from one EMR to the next, my clients didn't like it. They liked going to the old portal to schedule their appointments. They, would forget about it. They would go to send me a message to the old portal and get, frustrated. So I think it requires some extra bandwidth. And I really encourage everyone to do a self-assessment for their own good self-care. Do they have that time and bandwidth right now? Okay.
So let's take a moment to think about electronic medical records from the perspective of both clients as well as practitioners. Now, as it happens, I'm going to be showing you the Simple Practice product today, and throughout the series, we're going to look at different products. Please know, I'm never endorsing one over another. These just happen to be products that I use. As soon as I endorse one, I'm sure some features would change and I'd reverse that recommendation because the marketplace tends to move quickly. But for all intents and purposes, we're going to spend a little bit of time thinking about electronic medical records, what it looks like for us to schedule an appointment and initiate that appointment, as well as what it looks like for our clients to do so. Okay, so we're going to start off here, and you'll notice that I'm in my electronic medical record, and this is what the format looks like. I've really just restricted it to one day because I do actually use this product, and I don't want to be showing any PHI on my webinar. That would be bad. But you can see here I'm scheduling a new appointment, as it happens for a wonderful client named Sarah Test, which happens to be me. Okay, so now I have scheduled Sarah Test, and I want it today, the 16th. I want it at 10 a.m. and I want it for 60 minutes. Now, all of these are, changeable. So typically there will be a calendaring feature that allows you to select time, date, and length of appointments. Now, in my case, I happen to practice in multiple environments. I have offices in several Seattle neighborhoods, as well as my telehealth appointments. This is good for my own organization internally, and also when it comes to telehealth, important because when my software generates super bills or bills insurance, it's going to use different codes for telehealth billing. And later in the series, we're going to dig into the nitty-gritty of that. But for the moment, I'm just going to note that it is important for me to choose telehealth for several reasons. A, because this will mean that it will generate a link that will be sent to my client. And then additionally, it will bill correctly when the time comes to it. Okay, so I'm going to click done. And look at that. Here's a nice appointment. I'll note that Simple Practice does the extra step of always abbreviating clients' names. Of course, this is not a real name, but in the instance when it is a real name, I appreciate the additional layer of security of not just having my client's name sitting on a calendar. Okay, so now it's time to get ready for my appointment, and perhaps I would like to set it up and be ready for when my client appears. So I click on my appointment. And easy peasy, it says Start Video Appointment. So I'm going to go ahead and I'm going to click Start Video Appointment, and that will initiate the video call. And again, there are many different products, and we're going to look at different products together over this series. In this case, it's going to let me set up my camera a little bit. We'll figure that part out, and then the client will join automatically when available. So I'm starting my video appointment. Okay, now, I have to check my camera. Uh-oh, this isn't my face. This is the picture of my monitor that is behind me. So I'm going to have to make sure I select the right camera.
Sarah?
Yes.
Visibility is a little poor, just so you know.
Okay. Well, shall we move on then?
I'm thinking people might be struggling with seeing what you're trying to point out. It's pixelated to the point where you can't tell the words.
Oh, I apologize. From my end, it looks normal. I do apologize to everyone.
Okay.
All right. Well, let's move on then. I think the main features that I want to let folks know is that, when you are initiating these appointments, we want to be thoughtful about what the product offers us. So the Zoom product that we looked at a bit earlier had the great option of waiting room, and the Simple Practice product does it. It just puts you right into the session, and usually these things are pretty user-friendly. A video conferencing product that is integrated into our electronic medical record will have the benefit usually of just one click. You can join it, you can open the appointment, click, you're right in there. And then on the patient side, they would receive an email. Embedded in that email would be a link. They can click that link, and then they can join the appointment. I'm thinking maybe in future series, unfortunately, it looks like screen sharing is not going to be an option in the webinar product, but perhaps in future series, we could do a live demonstration so people can see exactly what this looks like. Okay, so let's think about a Vignette, Dr. X. So Dr. X wants to offer video conferencing to her clients. She's considering an electronic medical record. She has a practice that bills insurance, and that's how she makes her money. We're going to think a little bit about what is Dr. X's bandwidth to learn a new system. Is she in a headspace right now? Is she homeschooling 12 children in her house and managing her multi-site practice and her forensic practice and everything else? Does she really want to take on one more thing at this moment in time? Who does Dr. X serve? Does she serve a population that is, very tech savvy? I live here in Seattle, Washington now, and I got to say, most of my clients know more about technology than I do. I contrast that to times when I've lived, I actually grew up in a very rural portion of Ohio, and half of my family is Mennonite, and so they don't use technology much at all. So were I serving clients in my hometown, it would be a really different thing to bring those clients along, and using the product than it would be to use my Seattle clients along and using the product. No judgments on it. It would just be different. I would have to be thoughtful about my own understanding of insurance systems, Dr. X's own understanding of insurance systems, and the extent to which Dr. X is feeling like they want to fight the good fight of making that transition to a new billing of insurance. And then, is Dr. X alone or in a larger group? Is this going to be, an individual practice and they're just having to mind their clients in that transition? Or are they going to have to bring on an enterprise level solution for a larger group of clinicians and a larger group of clients, as well as financial flexibility? Is this cost problematic for Dr. X, or is this something that she can easily shoulder? Okay, so here's our first live Q&A. We're going to pause here, and David, if you wouldn't mind helping me sort of corral those great questions, so I want to make sure we answer them and address what folks are thinking about.
Super, Sarah. And we have 3 questions that came in. So this is a good time if anybody wants to pause and add another question, but I'll read them off. And you got 1 comment. But the first question comes from Scott and says, Capterra has dozens of categories. Which one are we looking for?
Oh, great question. And I realized I put Capterra with a K. How strange of me. So if we go to the Capterra website, that's CAPTERRA.com. And this is, a federally supported website. They do all kinds of reviews. So really, if you wanted to look at electronic medical records, they're going to have reviews there. If you wanted to look at video conferencing software, they're going to have reviews there. I mean, it's a much larger site than what we need, but really any of the drill downs, they're going to have, it's a little bit like Consumer Reports, I think, for medically oriented software.
And could you say that website, the company name one more time?
It's called Capterra, CAPTERRA.com.
Great. There was a shout out for Doxy.com. One of the people said that they use it with refugee and immigrant communities and works really well. So
Doxy's great. And it's a free product, which I really like. And they actually, I just saw from them, they're rolling out in beta format right now, their ability to have multi-caller, which is new. It used to be you had to pay to have a multi-caller feature. And I really appreciate that about a company that rises to the moment, and expands free resources for folks who want to do good work and take care of clients.
That's nice. And have a question from Tom, and I think this is a Zoom question. And Tom says, any way to control gallery of clients from speaking all at once?
Yes. So if you, depending on the type of Zoom account you have the ability to mute and unmute. Wouldn't that be nice if we had that ability in all of life with the people we spoke to? We can mute and unmute folks, and help kind of control speaking in turn. I will say it gets a little challenging. It depends on the size of the group. I would say if you have a really large group, it's absolutely indicated, just because even background noise can really be problematic for those larger meetings. if you're trying to facilitate speaking in turn, it's a nice way to do it. I personally tend not to do it. I ask folks to mute themselves proactively and then unmute themselves when they wish to speak, so they just don't feel that they've lost that autonomy. But, particularly if I had a group that was known to be boisterous, that might be a feature I'd want to use.
Okay. From Holly, are there all-inclusive telehealth programs a solo practitioner can buy into on a month-to-month basis?
Yes, absolutely. So, I think where I would really start with would be these electronic medical records. They really are the ones who I think are cornering the market on soup to nuts. That there are some that call themselves something like securetelehealth.org. But really, I think the big guy in the space right now, it seems to me, is Simple Practice. They seem to be cleaning up quite nicely. Theranotes, Therapy Appointment are also good examples. And they're going to have your video conferencing, as part of the product. They're going to have, your payment solutions. They're going to have insurance billing. They're going to have client portal. They're going to have document templates, a way to communicate with clients. They've got it all. Here's one caveat I will add though. And this is something, if you came to the last learning series, I always do counsel redundancy, having more than one video conferencing product, only because, a lot of times these products, especially right now, they just weren't made to withstand the traffic they have right now. So my EMR is great. I really like it. I like their video conferencing product. It does not have a lot of features, which is frustrating. And right now it is just struggling with the number of calls going through. So you don't have to pay for that second product. It can be a free one. But I'd say even if you find an all-in-one solution that you're really happy with, it's a worthy investment of time to know what you would hop on if it was just a bad day and it's breaking down.
Thank you, Sarah. Question from Demelis. Is video conference only for individuals, or can it be done with families or groups?
Great question. And this is something we will dig into later on. It absolutely can be set up for couples, families, groups. I think the dynamics become very different. So, and this is again where I think those products designed for businesses, your Zooms, your Skypes, your Googles, like they really shine in those moments. The healthcare products, I don't think do as nice a job with multi-caller. And I'm sure we could think of some examples that break, they break that rule. But I think what you are going to have to decide is where you want these folks sitting. It's a nice idea, if I could get a Zoom angle and have them all sitting in a room and I could just watch them all sitting in the room together, that'd be great. The practical reality is most of us are sitting, by teeny little cameras embedded in laptops. So very often you're going to have multiple callers calling in on different devices. I actually just did a family call like this the other day, and you miss a lot. I think you miss a lot generally in telehealth. You miss a lot of behavioral observation data, tapping toes and picking cuticles and small little things. You miss alcohol and breath. You miss, an unsteady gait. And so too, when you have more than one person, you miss the side eye that somebody gives their spouse when they say something. You miss the tooth sucking. You miss those little moments of, really rich interpersonal interaction data over the video milieu. I think they don't occur because that person's not sitting next to them. And, this thing occurs where they're almost interacting more with the therapist through the screen than they are with each other. So I think it adds some unique challenges. They're certainly not insurmountable, but they're ones we want to think about that group dynamic and how we want to array people in advance.
Wow, that's a very nice response. Here's one more question. Is there a difference between telemedicine and telemental health?
Great question. If there is, I'm not quite sure what it is. I think telemedicine is a more inclusive term. So telemedicine would include themes like teleretinal scans for ophthalmology or teledermatology, where they have these HD cameras that will look at your mole, all kinds of disciplines. We don't even call it teleradiology. We just, the radiologist isn't sitting there waiting for our scan to print out. They're elsewhere, typically in another building, and they will be sent that image electronically. Telemedicine just refers to the whole family of telehealth disciplines. Telemental health just refers to those mental health services delivered at a distance. It's a great question.
Okay, wonderful. Well, I think that's it for right now.
Okay.
I think I'll back to you.
All right. Well, let's head on down the road. Okay. So now we're going to talk a little bit about preparing your space. So how do I get my space ready, my staff ready? And for me, it is just the home office stuff is really, I don't know about you guys, but it is a different world right now. So, I think a lot of us are having to think about adapting or even adding space to our home, to facilitate working from home, particularly if we live in a state where we're not regarded as essential workers, or if we live in a jurisdiction where travel has just become really challenging. So, we want to consider the appropriateness of our space. And, the reality is that PHI and EPHI security demands on us at the professional office, they're on us even in our home office. So even though we may have kids that are doing homeschooling, we may have a dog running in and out, a new puppy that is piddling on everything, we still have to protect the information, and we still have to treat it, like a professional space. So I always like to start off thinking about just the basics. What is your availability of a private space and the feasibility of that private space? So, I may have a room that the doors can close and I will not be overheard, and, that's a good thing. But how feasible is it? Who else is in my home? I think this is particularly challenging if you're a parent of young children, or if you're a caretaker for another human being. I think it gets particularly challenging. And what hours are they active? So, for some of us, we are spending some of our time helping children with homeschooling, or we're playing a constant game of tag, with a partner, in terms of figuring out resources in the home. So I think we just start off really thinking, where can I do this? And who else is going to need that space? Who else is going to, if I may put it so bluntly, be a potential threat to privacy and security of my sessions with clients? Okay, want to think about our internet availability and what the demands of my telemental health practice would be. We talked a little bit about this last time. I'd like to talk a little bit more about it. This is a great time to upgrade our internet, but the problem is everyone else thinks it's a great time to upgrade their internet too. So many of us are home, working from home, socializing from home, watching Netflix, doing whatever. So I think we have these unprecedented demands on residential internet bandwidth. So if you can get an upgrade, it's a great time to do it. I know a lot of local carriers are really working hard. Bless them, they're trying to get out there and do good work and help people. But it may be the case that it's going to be a long wait to have that done. So if that's the case, I encourage folks to consider investing, particularly if telehealth is going to be in your practice for a while, investing in redundancy. And what I mean by that is, starting simply, many of us may have a mobile device that has what's called a personal hotspot, the ability to turn on tethering and to provide an alternate source of internet. If we don't have that, or if it's prohibitively expensive through our carrier, most mobile carriers for under $50 a month would happily sell us one. So it's another way to think about, if I don't want to, battle for the internet when somebody wants to play Minecraft, and I don't want to worry about outages, or maybe I live in an area that is just not that darn reliable, thinking of another way I could augment that and improve that. Want to think about a computer that has, the capacity. When I started off doing this work, and I'll probably date myself a little bit, I used to say, something that was, that was compatible with dial-up and things like that. But, these days, anything that's within, 7 years old should have everything we need. We need something that has a camera. We can have this embedded in the device. Most have them these days, or it's something through a USB port we can connect to. But it needs to have adequate memory and processing speed. Again, I'm not going to get too bogged down in the specifics of this because it's going to be the rare bird computer that can't support a video conferencing call these days. We want to make sure that we have our own profile for work on that computer. So, in my home, there are lots of computers, and some of them are just, they kind of sit there, and, somebody might walk into a room and click on a music or watch, some videos or something like that. That is not the computer profile I want to use to see my clients. I want to have a distinct user profile that only I know the password for, that I'm thinking of this as PHI. So even though I'm in my home office and using equipment that may be shared by other family members, I want to create my own profile, my own sort of distinct user world, for seeing those clients and for conducting telehealth. I want to think about whether or not I have phone service. I'm ready for the apocalypse in that I have a landline, but I know that's a random thing. Many folks don't. Do I have the ability to have a private line for clients to call. For example, I would never give my clients my landline number because they could get anybody in my family, and that wouldn't feel professional, it wouldn't feel appropriate. In my home office, I make sure I direct people only to my mobile device, and I actually have a mobile device line that's actually in my same phone that is explicitly just for my private practice. So when it rings in on that line, I know it's a business call, and if it rings in on the other line, I happen to know, it's my personal life calling, which is very helpful if I feel like answering something in the grocery store or, while I'm driving around, or all those things I used to do several months ago. Okay. And I should mention checking where in your home you have good service if you're using a mobile device. This has been a process of a discovery for many of us. Maybe a room that would be a great home office doesn't have very good phone service. So it's the type of thing we want to figure out in advance. If we're going to conduct video conferencing sessions, want to think through a nice, clean, clear, austere space. There's a bandwidth element to this in that we want to reduce the amount of data that has to be transmitted over the call and simplify that. But, we also want to think a little bit about what does this space disclose about me? If I have a bunch of family pictures or some really specific art in the background, what am I telling about my, about my personal life? And is that something I'm really comfortable disclosing in the context of a therapeutic relationship? I want to check in on the lighting. And not just seeing, well, okay, this room looks okay, it's bright enough, but checking it within that self view of the video conferencing program. I'd say common culprits that look just fine in person but show up very funky in video conferencing include overhead lights, backlit windows, or natural light coming from one side, sort of bathing us in light just from one side, can give a very odd appearance in video conferencing. If you have an Alexa or an Echo sitting around somewhere, and in my house, she is everywhere, you want to take it out of that room because they are always listening, and it is a concern for privacy and confidentiality. Dogs and cats, what can be said? I always say you never see the dogs, and cats are video stars. If you have a cat in the room, many cats will not be denied, is what many practitioners tell me, that they have a cat that says under no circumstances, will the cat be denied access to the room. But it's a challenge. Then the cat wants to sit in their lap. Then the cat wants to, stand on the keyboard. So I think we're all kind of figuring out how to have our personal lives integrate, with our home offices. But thinking through what's going to happen with the dogs and cats is probably a valuable forethought. And silence those tabs, those devices, turn the mobile devices to silent. I had a heck of a time figuring out on one of my home computers how to silence all the notifications that came through Outlook, that came through the Windows program itself. So just spending a little bit of time, muting all of those distractions, because when you get into the clinical environment, those are things that are going to detract from the moment and really have us focusing on the technology and not on the human interaction that's occurring. Acknowledging today, we're really deep diving into all those little funky, not clinical moments, but these are the things we do to help preserve that most important piece of telemental health, which is rapport, rapport and clinical relationship. Unfortunately, that's not the focus of today, but that is something we're going to dig into in the fourth lecture when we talk about clinical engagement. Okay, so we're seeing our home in a new light. I encourage folks to do a test call where we kind of go through the specifics with the client. Now, if you were here last time, I did a longer video on this showing folks what that test call might look like, but spending a little bit of time thinking through, how's the lighting? How does it, how audible am I in this room? And I would encourage those first test calls you're doing with the video conferencing product not to be with a client, but with a friend or family member. Make sure that they can see you, they can hear you. And then even as you're starting with a new client, as we spoke about last time, I encourage folks to have a 5-minute test if they've never used video conferencing before. Test out that work day in a home office. Can you make it through the day working in a space without a kiddo running in, without a cat losing its mind? Do the hours that you used to work in your professional office still work for you in the home office environment? Many of us are having to shift, to different hours to accommodate what's going on in our home. So adjust your schedules. Some people are doing evenings and weekends, because that's when things settle down in their home. Some folks I know, particularly folks who work with kids, have made the decision to abbreviate sessions, both for themselves and for their clients, because they're encountering fatigue with the modality, and they would really just like to schedule their days a little bit differently. And schedule breaks. I really can't overstate this. There's a natural pace and cadence that happens in seeing clients in person. I get up from my office, I greet them, maybe I get them a cup of coffee and me a cup of coffee. I'm moving, I'm getting a glass of water, I might use the lavatory. These normal human self-care things that in a video conferencing environment are very easily overlooked. So I really encourage folks to think about your self-care, adjust your schedule, abbreviate your sessions if you need to, and make this a priority. Do we need to, have help if we have young children in the home? How can we make sure that we are tending to everybody's needs? I'll share with you that I'm much more conscientious these days about ending on time. If, 6 months ago, I have to admit, I'm pretty bad about running over. Now I'm not, because in between my sessions, I'm spending those, 5 minutes to check in and make sure my house is not burning down and that homeschool is happening, before I go back to my home office and resume work. And again, I can't say this enough and in enough different ways. Contemplate self-care. What is going to make your office pleasant for you? For me, as the stay-home order has stretched out in our state, it's really come to a head that I really need to invest in my home office. My home office is fine, but it's very perfunctory. And, as I contemplate being here a few more months, I'm thinking through, well, this chair is okay, could be better. This lighting is good, but I would really like it a little more if it was like that. I'd like a fridge in here so I can have some cold water. Some of these things, they're small things, but I think they can really improve our experience of our home office. They seem foolish even to mention in a webinar context, but I think it's these small efforts of self-care, a nice place to sit, nice lighting, a pleasant physical environment can really make or break a day for us. Okay. Some of these home office hacks also include that hotspot or that mobile tether, as we spoke about. If you don't have good telephone reception for that mobile phone in your home, consider tethering to the Wi-Fi if you have Wi-Fi calling enabled on your phone. Some folks say, there is not a single place in my home that would look austere and professional. There's not a blank space of wall. And for those folks, I would encourage them to consider investing in a green screen. You can get them on Amazon. They're just a nice little pull down screen and they stand on a little stand. I had someone say to me the other day, why is that any better than a sheet if I'm not projecting onto it? And I said, I don't know. So I guess a sheet would also work. But, consider having something that stands up in the background and just creates that nice, blank, austere background. I encourage folks to use headphones in a home office. I think this is an additional layer of privacy and confidentiality for our clients. This way, our clients, we just know they're not being accidentally overheard. I also think it helps with some of the sound spikes and dysregulation that occurs with sound gates in video conferencing programs. So I think there's multiple points of benefit. Okay, making sure we have that reliable computer that if we need, if we are keeping telehealth in our practice for a long term and we've been working with a computer that's maybe not the best, it may be time to invest in a new one if our practice can afford to do so. This is such a silly thing to mention, but it's caused more problems for more people. Making sure it's plugged in and that we have a power cord, that we have everything we need, and not just relying on the battery of the laptop. Video conferencing programs are notorious battery thieves. So, making sure that we're not just relying on charging up the computer previously, but that we have an actual place to plug in the computer and maintain the call. Lamps, can't say enough good about lamps. Investing in a $10 lamp on Amazon can really improve the quality of a video conferencing call and not just relying on overhead lights that may look perfectly fine in normal day-to-day, but in video conferencing may look a little impoverished. Make sure you have a good place to sit. Many folks have told me in their home offices they're using folding chairs or, chairs that were previously an old dining room chair that were stiff and uncomfortable. As best we can, I think we're going to be seated for even more hours than we do when we do in-person care because we're not having that experience of getting up, moving around, rooming clients. We're just going to be seated the entire time unless we are intentionally engaging in self-care and getting up. A system to indicate when you're busy. I think this is particularly salient if we're sharing a space with family members, if we have children in the home. I'll tell you on the outside of my office door is a sign that says when I can be, knocked and interrupted and when I cannot. And this helps to signal, to folks that if they need me, just wait till the end of the hour, or, if it's just fine for them to come on in. Right now it says they're not allowed to come in. If you have very young kids or very aggressive pets, some folks have invested in a door latch, kind of intense, but I know some folks have said, there's just no way my 2-year-old's going to listen, and he might get away, and I don't want to have him wandering into a session. And so they've invested in either a child safety latch or a door latch that actually prevents the door from being opened. Okay. This one has no screen sharing, I promise.
Okay, so let's talk a little bit about preparing your space. And this is something we've spoken about in previous classes, but I'd like to dig in a little bit further. So I've chosen a room in my home that's a pretty average room. It's a bedroom. And we're going to take a little tour. And I want you to know I didn't pick up on purpose. So please don't be offended. I'm having you in my home. Didn't even clean up, but it's kind of on purpose. Okay, so let's take a little bit of a look at the features of this room. Now, first and foremost, I'd like to think a little bit about lighting. Now, I happen to have some natural light in this room, which is great. However, my natural light is coming from the back, giving me a certain ethereal, angelic glow, and can make me darker on my client's screen. And sometimes if I move around within that screen, we can see shadows and shades on my face. Sometimes the light or dark will change and fluctuate as the light from outside sort of is blocked or unblocked. And it can be a little bit distracting to the video. Now, there's also a lamp in this room. And as I mentioned in previous videos, when you have an overhead light, sometimes that can look like a terrible sun in the background of your video conferencing. So I want to be a little bit thoughtful about the lighting in this room. And that's something we're going to talk about how to correct that in a moment. So what are some other features I'm going to be thinking about? Well, you can see my head decently well, but I'd like you to be able to see a little bit more of me. So I'd like some place in the room where I can back up, and I'm wearing my good luck t-shirt, so I have a good time with my video conferencing call. But I want to make sure that you're able to see me and to see, sort of facial expressions, perhaps, part of my hands as I move. So, what could I do to improve this? I'll tell you guys, I always have a book or a stack of envelopes on my desk, because what I'm going to do is I'm going to take these envelopes right now and I'm going to put them underneath my computer and change the orientation. So now you can see my good luck a little bit better. Now you can see me and see more of me. This can take a little bit of finagling, and I will not lie, sometimes you can overdo it and make the computer close, but do your best. Some of us may have top-mounted cameras on top of a monitor that are adjustable. I happen to have one that is embedded in a laptop, so I actually have to move the laptop and finagle the angle of the laptop opening. Others may have it embedded in a stable, unmovable monitor, in which case we just do our best. But when possible, propping up the hardware can create a more advantageous angle. So let's think a little bit about what we're seeing in this room, and then we're going to pick an area in the room that might be most advantageous, and then we're going to do the same thing in a client space. Okay, so let's see, what do we have here? We have some family photos. Do I really want to disclose what my family looks like? Apparently I'm willing to do so with y'all, but do I really want to have conversations about certain family photos or what we were up to? Do I feel comfortable, letting my clients have access to that part of my life? That would be something I'd really want to think about. I've got some groovy art in the background. I have a communist leader wearing a party hat. Let's see. Oh, I have an unmade, terribly messy bed. Yeah, these are a lot of things I don't know if I would really want to share in the context of a therapeutic relationship. Additionally, if I was outside on the rolling hills of my French villa, which is obviously where I am right now, do I want to disclose that I live in a beautiful French villa with rolling hills and my vineyards? Maybe not. Maybe I don't want to disclose that vivid fantasy that I'm having. Okay, so we're going to choose a space in this room that has advantageous lighting, that has fewer disclosures about my life. And additionally, I just want less information going on because recall, every time we have a fluctuation of light, every time there's a dresser or a picture or something in the background, that's more data that is going to be required of your video conferencing call. So really, I'm trying to pick a place that's pretty darn boring in this room and go from there. So let me see, I think I see a boring spot that I could use. Let's go take a look at it together.
Well, this space is a little more clean and clear, no pictures, lighting's more stable, and, no messy beds or other furniture or, disclosures about my life. However, what's a problem here? Well, we have one open door going to the bathroom. We have another open door going to the hall. Now, it happens to be in my home that, in fact, leaving this door open does not, significantly impair the security of this space because there are 3 other doors in between that and, where people could get to. However, my client doesn't know that. So, for the purposes of this call, I'd want to make sure every visible door is closed, even if it doesn't particularly lend itself to the information security and privacy of the call. I think it's going to instill more confidence for our client. So I'm going to go ahead and close that door. I think that's better, gives more of a secure look. But here I am wearing my good luck t-shirt and it's a little informal. Yes, I have tamed my overgrown quarantine hair, and I put on some earrings to try to just connote a sense of professionalism as I would in my office. To be clear, I think you can do good therapy without earrings. Just in my case, it's what I choose. But, I might want to be sure that I am looking appropriately professional for the call. So I'm going to Mr. Rogers for you here. Put my jacket on. And I'll note that I actually don't wear suit jackets typically in my sessions in my Seattle offices. I'm more of a sweater and slacks kind of gal. But I do wear suit jackets on my video conferencing calls. And why do I do that? I do that because I think it, again, connotes a certain element of professionalism and decorum that I think helps elevate the appointment, benchmark expectations, and help my client really understand that this is a medical appointment that is for their health and not a chat with a friend. So it's in these small ways I seek to differentiate the chitty chats they're having with their friends and family over Zoom, from the healthcare appointment that they're having with me. Okay, so I think we're in a pretty good spot. Probably wouldn't wear a t-shirt under my blazer normally. That's okay. Highlights the distinction. Okay, so we've done it for our space, but now how do we do it for our client's space? Let's think about that. Hi, Jason.
Hi, Dr. Smucker.
Well, thanks for joining me to talk a little bit about client environment and how we can help practitioners help their clients get the setting just as they need it for a video conferencing appointment. Well, the first thing I'm noticing is I'm not seeing much of you.
Oh, yeah. Yeah, sorry about that. Okay, yeah. Got it. All right. Yeah.
Yep. Oh, I'm seeing more of you now. I'm seeing like 75% of you, I'd say. And I guess a question I would have would be, are you going to sit during this appointment?
That's probably a good idea.
Okay.
Yeah. Okay.
Let's maybe adjust the camera. Oh, that's great. And that way you can be seated and be comfortable and we can see each other. And this is a good point because a lot of people do point their cameras up at the ceiling or disable their cameras, or they do something to help mitigate and minimize, those confidentiality and privacy concerns. So, the next thing I'm noticing, Jason, is it's a little dark in your space. I can see you okay, but in our prior meetings, I've seen you with a little bit more clarity. I wondered, is the light on in your room?
No, I'll be right back.
Okay, excellent. Very nice, very nice. I can see you really nice and clear. Great. Now, I see this appears to be your home office.
That's right.
Okay. And is there anyone else in the room with you currently?
No, but my daughter is just outside the room. Okay. Should I close the door?
I would recommend it. Let's close the door and again, help make this space a secure, confidential, private space for an appointment.
Got it. I'll be right back.
Sounds good. Fantastic. Okay, Jason, just a couple more questions. Let's talk about devices. Do you have a mobile device or
Oh, yeah.
Alexa? Always.
Lots of them. Yeah.
How many of those are currently set to silent?
Well, this one is now. Yeah. Okay. Got it.
So a good ethic moving forward is we want to turn off those devices. If you happen to have a smart speaker in the room, we want to get rid of that. As I always like to joke, Siri, are you spying on us? Nope. She says no, but I just don't know. Okay, so we want to make sure we click off those other windows if we can, so we're not receiving notifications the entire time, and really just try to minimize all the noise and interruptions to create this space to be a private, secure space for healthcare.
Done.
Okay. Well, thanks, Jason. Thanks for taking the time to spend with me today and to go over some of those basics for client location.
Thanks, Dr. Smucker.
Bye. Okay, so we've spent some time thinking about home offices. Now let's spend some time thinking about our professional offices. Many of us may elect to conduct telemental health from our professional offices, and this is a great option. And I think one of the things to note is that these offices are going to be conducive to care, and that, oftentimes they're going to have lighting that we've already solved for. We already have a more professional, sort of professionally lit space. Typically, we'll have internet bandwidth that is greater than in our homes, not always, and we've already worked out some of the telephone reception issues. So, a lot of times if we have the option of going to a professional office, if that's a safe and healthy thing to do for us right now, but we don't want to be seeing clients in that context, it can be a great option for how we see our telemental health clients. Okay, again, having clients, alert to the change, that they're going to be seen in the professional office. I think it can help them feel more at ease at times if they feel familiar with the office environment. Particularly if we're going to do a combination of in-person and telehealth services as we move forward, there's something nice about that continuity. And, as we would in our home offices, we lock up our hardware. We don't use shared software profiles. We don't share video conferencing programs with our colleagues, where they use it one day and we use it another. We have separate profiles, separate login information. And consider how often you're going into that office. So for me, I'm not going into my physical space as often. So I'm thinking through how I'm going to receive my mail, how I'm going to receive my faxes, particularly if I'm going in to conduct my telemental health appointments. I want to be thinking, do I still use that office fax, or is it time to invest in that digital fax? Things like this. Do I need to forward my mail? Even though I am going in physically, I want to prepare that space in a way that's conducive to how I'm actually practicing. Okay, let's talk about Dr. Octagon. He is a therapist who works in a professional office and sees clients. He's an essential worker in his state. He has a home office that is shared with kids and is very hectic, limited internet bandwidth at home, and just working a lot of different hours, may serve a population that by necessity requires him, working a broad span of hours. So we'd want to think about the safety for his health of his professional office. Is it conducive to him delivering care from there? How able does he feel to maintain his privacy at his home office? Would it just be better for the maintenance of PHI for him to be at a professional setting? What are the internet capabilities? Does he have tech support at work, that he doesn't have his home? And of course, the appropriateness of a home space. Okay. Thinking through some of the themes of client space. So, I want to know, in some ways, we're doing the parallel function with our client's home office. So these are the same requirements for our clients. Of course, our clients are going to have more flexibility. They're not HIPAA-covered entities. We are. And strange times call for strange appointments. I've seen folks in their closets, in their bathrooms, a few in their car. I think we do our best. What we must have is either an internet or a data plan that can support the call, a computer with internet and camera, or a mobile device for a telephone call. And again, we want to really encourage them to have unique logins and not to do this from a shared, general computer in their home. They must have a private email address where we can send them video conferencing links if we're going to do video conferencing. We are going to ask them to have some sort of agreement with other household members that they're not going to come bursting into the room. So they've let them know that they're having a private meeting.
and that we want to make sure they have some light. I had a story from a colleague about they couldn't see that a client was tearful, because the lighting was so poor, and this was something, they corrected moving forward. We must have an understanding of the risks and benefits of, meeting remotely, a willingness to participate in their security. So they're not forwarding their links, they're not recording their sessions, they're not giving out their passwords. They're really being good advocates for their own information privacy and security. It's nice to have, if they have a professional space to use, it's a nice thing to have, if they're working from a home office too. If they have an appropriate seated position, I really do prefer seeing folks seated in a chair at a desk and not balancing me on their knees. It tends to nauseate me a little bit if they're moving around with a mobile device, or if they're, sitting, somewhere where it's wobbly. And, they must have some it's nice to have some willingness to disclose their concerns. Can they talk about what's hard about this? Can they talk about what they like and don't like? It's nice if we can have, candid conversation about that. Okay, this is our second time where we're going to take a pause and answer any questions before going on to our final discussion of preparing staff and preparing to return to our physical spaces.
Wonderful, Sarah. Looks like I have about 6 or 7 questions for you. So here you go. Tyra, she says, when providing services with a family, is it better to have them log on different devices if possible?
It's a great question, and I'd say it has everything to do with the endpoint available at that family's home. So if we were to do a family session in my home, it so happens that in our television has an integrated webcam. I don't know how this happened. This was a very clever television. So I could actually, for many different programs, I could tether from a computer, and we could use the camera and see my entire family seated on a couch. That's rare. That's a weird thing that we happen to have. Most often, if we're trying to get people on one device, we're having them scrunch up uncomfortably, which I think may become a clinical issue in and of itself. So if the client has an obvious way that they have a large sort of wide angle camera that they can do this with, and they've done it before, I would say, yes, it's great to get them on one device, because again, we can see those small interactions, those nuanced moments. But practically speaking, if they have separate devices, it may be the best way to go. But that's the other thing to consider. There may be one computer in the home, in which case we're going to ask everybody to back way up off the camera, sit maybe 6 feet back or so, so we can get everybody in the screen.
Okay. From Francine regarding physical space, can you address the demands on the therapist of interacting on the screen for long hours and an increased already sedentary lifestyle?
Oh, yes, absolutely. I mean, Zoom fatigue is real. I don't know how much folks are reading about that. It's hard, and I think, my spouse is a technology worker, and he has a standing desk, and sometimes, he'll hop on the stationary bicycle and work from there, and it's, by contrast, it's not appropriate for me to do. I think it would be unsettling. I could stand, I suppose. I think it's a little unsettling. I think this is where scheduling breaks. This is where, I'll be honest, in the summer, I have to compress my schedule right now because of some of the childcare demands, but I'm also looking forward to it to make sure I'm getting out of the house, getting some fresh air in appropriate mask wearing ways. But I think for each of us, we're going to need to contemplate how this fits into our self-care, because too easily you can spend 6-7 hours just seated. And it's, they say sitting's the new smoking. It's not that great for us. And so, figuring out how you're going to take care of yourself in a way that feels authentic, I think is important.
Okay, here's kind of a tech question from Kimberly. Sure. Do different video telehealth options have different video quality? For example, Doxy versus Simple Practice. I've been using Doxy, and they assert that the video quality is based on each individual's bandwidth and has nothing to do with their service.
Yes, I've heard that too. And that's going to be our first suspect, right? I mean, seriously, like it is absolutely the case that bandwidth is going to be the first and largest influencer of how good a call is. So, if a client doesn't have adequate bandwidth in their home, or on their mobile device, this can really just be a deal breaker. That being said, anecdotally, I really just believe that there are differences between the products. I mean, I don't know what else to say other than I will sometimes be on one product and hop on another, nothing's changed about my bandwidth, nothing's changed about the client's bandwidth, but instead of being kicked off, every 4 minutes as I was on one product, I have a totally clear, fine call on the other product. I appreciate the ethic of what they were saying, but I do think that we're in this, and 6 months ago, again, I would have said, oh, absolutely, they're all pretty comparable. But right now, I just think we're seeing so much use of these products because so many people have transitioned to telehealth that I really do believe there's an impact on the quality.
Cool. Question from Tom. Do you have any guidance we can provide for new clients who by self-admission are not tech savvy?
Sure. I think we have to really validate their decisions and their comfort and discomfort. Always, again, 6 months ago, if a client said they weren't comfortable, I would say, well, what are we even talking about? Of course we serve them in person. We wouldn't even consider it. This is a very different circumstance. And it's the first time in my, career that my own preferences and thought about my health is directing some of my decisions about clinical care. And it's something I have to think a lot about. That being said, I think there are some things we can do. Doing a test call with a client to walk them through the mechanics of clicking on the link, of getting situated for a video call, of what requirements there are in their environment, I think can be very advantageous. Alternatively, I think we can be, if some people just say they don't want to do it, they do a telephone call. Telephone will often be reimbursed differently, and every state's a little bit different right now in this regard. But I think there's no downside to just doing a phone call if that's really what works best for the client.
Okay. There was a statement that came from Felicia, but it was a really good one that I thought maybe you might want to comment. She said, we must be able to take care of ourselves in order to provide healthy care to others.
Isn't that well said? Absolutely. Yeah.
Okay. Can you say more about matching your clothing to fit your culture and community?
Matching my,
like your outfits and clothing.
Sure. That's a good point. There have been some clinical environments, I would definitely not show up in a suit. It would be weird. Like if I went home to my community in Ohio and I walked into some of the clinics where my friends work wearing a suit, I would look like the tax collector, honestly. I think being thoughtful about what clothing makes clients feel comfortable, makes them feel like accessible and like this is, they find you relatable, particularly as we bring on new clients who maybe we don't already have an established rapport with, particularly as we're doing intakes over telehealth, this becomes really important. I will say that for me, I often do wear a suit jacket. I do, I do because I want to add an element of formality. That's my choice. I don't think it's necessarily the right one for everyone. Your clinical population you work with, the community you work in. I'd say in Seattle, people tend to be, we're sort of jokingly known to not be very fashionable, but people do tend to be, when you go to the doctor will often have a suit jacket on or, some type of formal wear. So I tend to try to echo that in my own choices. But I think it's a very valid question that we want to be thoughtful and really client focused on in terms of what we're presenting, because there's such limited visual data that we're sending through to the client. We want to choose thoughtfully.
Cool, thank you. Kimberly asked about, is there a handout to prepare patients to set up their space for a therapy session?
Yes, what a great question.
and there's a second part to it. So then has it been useful in the past, or does it all need to be reviewed during the session time?
I would say yes to all those things.
Okay.
And this is something we're going to talk about next session. I always send out a one-pager, and many of the electronic medical records actually have like a little one-page thing you can send to clients. I do anticipate then reviewing with them again. I do think it's helpful, and most people say, oh yeah, I did read that, or sometimes they come clean and said they never read it. But oftentimes people have read it. And I think it's a great thing to do. I would anticipate still verbally reviewing it though.
Okay, thank you. And I'm just watching time. We have like 12 minutes left. I got 3 more questions. Should I go with the questions, or?
Let's go with the questions, and then I'll move pretty quickly through our slides.
Okay. Question from Jolene. Could you please speak to therapists with sensitive nervous systems? For example, dysautonomia, highly sensitive person, chronic fatigue syndrome. Telehealth seems to be very draining for this population.
It sounds like this person knows this population very well, and I would certainly defer to their expertise. Your clients, you know what works well for them. I will say that for the data on telehealth, there's no explicit prohibitions. There's no exclusion criteria that say, oh, never serve this client, they're no good for telehealth. I'm not aware of that. That being said, I think we're all in a pretty steep and fast learning curve figuring out what works for our clients. I'll share that many of my colleagues who see pediatric clients have found that the kids are just in such a place of video conferencing fatigue. They're in homeschool, online all day, and they're young, and the prospect of sitting through that is, very daunting. And so they're abbreviating their sessions. So too, if I was working with a population that was adversely impacted by the modality, I would consider a few things. Are telephone sessions better? Does that just more advantageous to that population? Do I need to abbreviate the sessions? Is that going to, make the experience better? Do I meet with less frequency? Is that clinically indicated and appropriate for the client? These would be things I'd be thinking through.
Okay. One person is still a little bit confused about family treatment.
Sure.
So the question is, does each family member have their own login to the session?
Great question. Yeah.
So let me just,
No.
go ahead.
Yeah, typically no. So here now I'm going to break the rule, right? Usually what I've seen the video conferencing program generate will be the same link and password, because they're all intended to be at the same time and same place. So we're sending that same, just as everybody today received a link, to this Zoom meeting, we're all supposed to be at the same place, the same time, same password. It's a great question, because we so emphasize unique links, unique identifiers, but if we're all intended to be in the same space at the same time, they typically do use the same information. At least that's what I've seen.
Okay. Question from Melvin. How many clients do you suggest in an 8-hour day?
Oh gosh. That's a really good question, and I think that has so much to do with how you usually practice. I will admit I'm someone who kind of clinically gorges. I'll see 9 clients in a day, and I would not necessarily advise that to anyone else. It's something that I like to do, and there are various reasons I like to do it. I'd say start small, particularly if you're newer to telemental health and not sure if you're going to like it. My thought would be, try 1 or 2. How do you feel? How do you feel going to 3? Add it to 4, and take breaks, schedule breaks. You don't have to start everything on the hour. I find myself, I'm now starting 15 minutes after the hour, and then 30 minutes after the hour, then 45. And in this way, I'm allowing myself a little bit more time in between appointments to walk around, get a snack, make sure my house hasn't burned down from homeschooling. Some of these themes I think help to keep it more livable.
And one more question from Landaka wants to know, how would you keep a young individual engaged in a session?
Sure. This is such a good question, and we're going to have an entire learning series session dedicated to it. Generally, I would say, we do our best. I think screen sharing, a lot of my colleagues are using a lot of screen sharing. They're using videos, they're using games, they're using some of these features to the advantage of the appointment. They're acknowledging the difficulties. In the old days, we used to do goofy things like zoom in on our eyeball and try to make it silly for the kids. I think kids now are a little savvier and would find it dorky, but I think we're doing our best. But my general gestalt is keep it more brief, use the screen share features, and many people are involving parents more in the session because it helps to keep kids on track. I think that creates a lot of problems for privacy and confidentiality and what gets shared in the session, but it is an option.
Okay. I noticed a note, but I'll turn it over to you now. Okay. And I'll mute myself.
We'll go a little bit quickly through our last portion. Much of it is review, and that's just fine. So, we want to think about how we're preparing our staff in the use of telemental health, particularly if we have administrative staff that supports our practice who is teleworking. So check if your electronic medical record or any other software that you're using have admin access. Sometimes they'll have a limited permissions, account that you can affiliate with your account, someone who can log in and see some portions of the account, but not others. I know some clinics are using video conferencing to have administrative staff check in a client, and that's a great way to use the tool. If we are doing this, however, those administrative staff are beholden to the same rules. They have to make sure their office is ready. They have to protect privacy and confidentiality just as we do. And this is the same in their home office as well as their professional office. Again, their home office is going to require that same level of diligence and oversight. We're going to need to think about how we're communicating about PHI with our staff members securely. So same considerations about secure message, secure email, so forth. Okay, thinking a little bit about the coronavirus. Again, as we return to in-person care, knowing our jurisdictional rules, knowing our regional facts, and I'm really just summarizing some of the guidance from APA and the trust. I think a lot of us were making this jump where telehealth was just at first all about getting clients to a place that they could just get some interim sessions, before we return to in-person care. Some of us are contemplating keeping telehealth in a longer term, function in our practice. So we want to think through our health risks, the risks of our clients. What population do you serve? I think it's really different. If I serve, my clients who I serve, who have themes of domestic violence in their life, I'm thinking very differently about my clients who have medical complexity. They may be the same clients sometimes, but these are themes I'm thinking through about whether or not telehealth is going to be appropriate or return to in-person services. And your own mental health, how good is this for you? Is telehealth wearing on you, or is it more stressful to return to in-person care? Both are really valid considerations. The recommendations from APA and from groups like the Trust are that we continue to use social distance, that we, maintain cleaning of surfaces and use hand sanitizer. And in fact, the recommendations from APA and the Trust would have us wearing masks during therapy. I know this is controversial, and I want to be really clear. I'm not opining one way or another, just noting that this is what they say. And for some I've talked to, they say, gosh, I don't want to wear a mask. I respect that that's a good idea. I'm going to keep doing telehealth with some clients. And I mentioned that, we know I'm a telehealth proselytizer, so take it with a grain of salt. As we return to in-person care, thinking about how we need to update our informed consent. APA and the Trust offer free online templates. I really encourage you to take a look at it, but really making sure that clients understand the risks of in-person care, just as we made sure they understood the risks of telehealth. Consider altering your cancellation policy. I have to say I've been much more lenient. And as I return to in-person care, if someone's feeling sick, I really want them to stay home. So I'm going to be much more lenient about this. It's funny. The Trust is the American Insurance Trust. They're a malpractice insurance carrier for many healthcare providers. They're great. You can find them online, and they have a great document library. It's funny, in the early days of telehealth, we always had to justify why telehealth. And now I feel like the alternative now, these guidance documents would say, well, why are we doing in-person care? Why are we going back? Again, I really respect everyone's individual autonomy to make these decisions. Okay, in the interest of time, I'm not going to go through our summary slides. Y'all have access to them, but these are all things we've talked about. We've had some really great questions submitted. Specifically, can we see clients in the car? And I always say, well, where is the car? For some clients, the car may be their best option, but we want to think through our ability to respond to emergencies if they're in a car and think through their safety. And we want to make sure they're alone in the car. I have a funny story of, someone telling me they were alone in the car on a telephone call, and then lo and behold, I heard their kids fighting in the background. Turns out they weren't so alone. Zoom fatigue solutions. There are eyewear options that help block blue light, that kind of help our eyes not desiccate in our heads. Making sure our lighting is appropriate and not straining our eyes, making sure we have comfortable seating, making sure we're scheduling that self-care, that social time, that leisure, and considering, do we want to reduce our hours, not see so many clients in a day? Last time someone asked me about voice over internet protocol, and I did a little bit of homework that I wanted to share. Here's the answer, the best I've got it. VoIP or voice over internet protocol, like your Google Voice, your Skype voice, they can be HIPAA compliant. But the differentiating factor is when you purchase them through a HIPAA compliant service like Google for Business or Skype for Business, by example. Specific brands, you're going to have to turn some features on and off, and there are going to be helpful videos on this. And we really just want to think through, what our options are. I notice we've advanced to our last slides here, so I'm assuming it's getting to be the end of our time. And so, David, do you want to help us wrap up in our last few minutes here?
Yes, indeed. And I think my folks don't know this, but Jennifer Verbeck has also joined us on this call, and she's been taking care of all the technology today. So I want to give her a big thank you for doing that. As far as questions, I'm doing a double check here and see if we have some final questions. One came from Michelle about suggestions on building rapport. I think it's probably a longer question, but do you want to say anything like that, building rapport for a new client?
Sure. And I think we're actually going to have an entire learning series session dedicated to this with lots of clinical demonstration videos. Generally speaking, I think a little levity goes a long way. I encourage folks to be lighthearted about it, to do a test call so you get to know each other. You're not meeting for the first time on the intake. Collect information beforehand and read it. I do a pretty comprehensive intake document. I make sure I really come to that first session knowing that already, because it's my expectation I'm really going to slow down. I'm going to ask a ton of questions because I'm not going to make as many assumptions about what I'm observing over the video conferencing modality.
Okay. Sarah, this has been fantastic. Your material is really, really rich. We had lots of compliments come in on the chat, so thank you very much.
Well, thank everyone for coming. And if you have any questions we didn't get to today, or you like me and you think of it later, please don't hesitate to submit it to this nwattctelehealth@gmail.com. And that's something that I'll be monitoring and happily respond.
Wonderful. There were still some questions coming in, but I wanted to say thank you to everybody that was here today. We had 129 and 115 all the way up to the last minute. So you folks were very attentive and very much appreciated. The next Telemental Health is on May 26th. And I typed in the same thing, so sorry about that. The next one is Client Selection Intake Assessment and Telehealth Health. Did I get that right, Sarah?
Yes.
Okay. And tomorrow we'll be sending out a link to everybody with a link to the PowerPoint and the recording, and also we'll include a link to the survey like it's in the chat box, and we'd love it if you folks would fill that out for us. And I think with that, thank you all for attending, and we'll close for this evening.
Thanks so much, everyone.
Good night, folks.